Hi, my name is Stacey Gardner. Good morning and thank you everyone for coming. Today I'm going to talk about ethical decision making. After what this structure and memorial staff nurses and nurse managers experienced during Katrina, I feel that we can learn from what happened, and I also think it's necessary to discuss ethical responsibilities and decision making during extreme conditions for use in the future. During this presentation, I will review what ethics are and what the foundation for ethics is based on. Most importantly, I will talk on how one can make an ethical decision during extreme circumstances. Hospitals, including Oxnard, place a large amount of trust in all their nurse managers. Nurses at all levels are held to a high standard of ethics. Every day, decisions are made by me, you, our DON, and our staff nurses. My goal is to educate you so that you have the necessary tools to educate your nurses so that they will make ethical decisions in their individual practices. Our mission statement and vision statement infers that ethics is an intrinsic component within the underlying significance of each statement. Our mission statement says we serve, heal, lead, educate, and innovate. Our vision statement says Oxnard will be a global medical and academic leader who will change and save lives. We will shape the future of healthcare through our integrated health system fueled by the passion and strength of our diversified team of physicians and employees. So what are ethics? Ethics is a set of moral obligations. It is a branch of a philosophy study that analyzes moral behavior. The history of ethics can be dated back to ancient Greek and Roman times. The study of ethics is based on several fundamental theories. The most commonly utilized theories are the utilitarian, deontological, and virtue-based. The utilitarian theory suggests that an action is right if it promotes the best outcome. The deontological theory suggests that certain acts are never ever permitted even when the end result is apparently less good or causes an apparent greater harm. And the virtue or character-based theory focuses on the person's character traits and trusts that their moral good character will prevail when making decisions. So what else? Morality and ethics also considers beneficence, non-maleficence, autonomy, and social justice. Beneficence is a promotion of good and removal of existing evil. Non-maleficence simply means above all do no harm. Autonomy means personal independence, and social justice is fair treatment for all. There are 6 virtues that contribute to moral character for health professionals. Compassion, having an active regard for another's welfare. Discernment, the ability to make fitting judgments and reach decisions without being unduly influenced by extraneous considerations, fears, or personal attachments. Integrity is a faithfulness to moral values and standing up for what one deems to be right. And conscience is a form of self-reflection on and judgment about whether one's acts are obligatory or prohibited, right or wrong, or good or bad. In August 2003, Katrina reached landfall in Louisiana. At Memorial Medical, now a part of the Oxnard healthcare system, decisions were made that were not based on ethics. Instead, unilateral decisions were made and team members were not consulted. All nurses at Memorial were responsible for making ethical decisions and intervening when they questioned the unethical actions of a colleague. However, this did not occur, resulting in the loss of lives because of healthcare providers giving medications and doses that hasten death in order to ease their suffering. The horrific events at Memorial stress the ethical duty to plan for the unexpected so we can realize our mission and vision statements. When resources and morale run low, then sheer exhaustion sets in. Well, this just sets the stage for poor ethical decision making. If a person is pre-armed with knowledge, then they will be better able to make appropriate decisions in the future. So how do you care for patients with no electricity, no air conditioning, no communication, no sewer system, no organizational assistance, and no rescue in sight? Was the American Nurses Association's Code of Ethics in the forefront of the minds of staff at Memorial? As conditions at Memorial deteriorated, so did the decision-making abilities of staff. Decisions were made to hasten the deaths of some of the more critically ill patients. So, would you consider the E word? Euthanasia, derived from the Greek, means good death. Is euthanasia ever justified, even if the patient is suffering with unbearable pain? If the patient is a DNR, the patient wants to die with dignity or wants to die in peace, and the patient always does have the right to autonomy. But who is to decide this? Who's to make this decision? Well, this is where moral, ethical dilemma is hit. And this is also where ethical decision-making skills become critically important. Educating yourself on the American Nurses Association's Code of Ethics can assist you when you are faced with a moral dilemma. Provision 6.2 of the American Nurses Association Code of Ethics states that virtues focus on what is good and bad in regard to whom we are to be as moral persons. Obligations focus on right and wrong or what we are to do as moral agents. Nurses in all roles must create a culture of excellence and maintain practice environments that support nurses and others in the fulfillment of their ethical obligations. Provision 5.4 addresses the preservation of integrity. In some settings and expectations that nurses will make or take actions that are inconsistent with nursing ideals and values, or that they are in direct violation of the code may occur. Nurses have a duty to act according to their personal and professional values and to accept compromise only if reaching a compromise preserves the nurse's moral integrity and does not jeopardize the dignity or well-being of the nurse or others. When nurses are placed in circumstances that exceed moral limits or that they violate moral standards in any nursing practice setting, they must express to the appropriate authority their conscientious objections to these situations. Additionally, 8.4 specifically addresses nurse responsibility during extreme circumstances, such as what happened during Hurricane Katrina. Nurses must be mindful of competing moral claims, that is, conflicting values or obligations, and bring attention to human rights violations in all settings and contexts. It also says that human rights may be jeopardized in extraordinary contexts related to fields of battle, pandemics, political turmoil, regional conflicts, or environmental catastrophes, where nurses must necessarily practice under altered standards of care. Additionally, Provision 8.4 states that nurses must always stress human rights protection under all conditions, with particular attention to preserving the human rights of vulnerable groups such as women, children, the elderly, prisoners, refugees, and socially stigmatized groups. All actions and omissions risk unintended consequences with implications for human rights. Thus, nurses must engage in discernment, carefully assessing their intentions, reflectively weighing all possible options and rationales, and formulating a clear moral justification for their actions. Only under extreme and exceptional conditions, while conforming to international standards and engaging in an appropriate and transparent process of authorization, may nurses subordinate human rights concerns to other considerations. So for your consideration, had these provisions been considered during Katrina, would lives have been lost? We do not know what the answer to this is. However, we do know that being cognizant of the contents of the ANA code, different decisions might possibly have been made. Hopefully, in the future, nurses will be able to make decisions that are based on ethics and not made in the moment. When making decisions, it is necessary to actively and mentally be involved in that process. There are 7 tests for ethical decision making. Ask yourself, is it legal? If the decision you must make is illegal or borderline legal, it is probably not the right decision to make. Does it hurt anyone? This can be difficult to ascertain. Some nurses do not always look at a situation outside the box. As managers, it is expected that you have this skill and consider problems from all angles. Next question to ask, is it fair? Again, this is difficult for someone to look outside the box. More experienced nurses have the critical thinking skills to look at a problem from all perspectives. It is important to foster improved critical thinking skills amongst your nurses. The next question is, am I being honest? Are you being honest with yourself, with your patients, with your facility, with family members? Do you find yourself trying to rationalize things away? If this is the case, then chances are this is not the proper decision to make. Can I live with myself? This is a question that only the individual who is making the decision can answer. I personally wonder how some of the memorial nurses and physicians are faring after the decisions they made during the hurricane. Are they haunted by their decisions? I wonder that. The next question you can ask is, would I publish my decision? If your decision was published, would others likely find fault in your decision? Think of the published decisions of the U.S. Supreme Court. The Supreme Court justices are often criticized for decisions they make. Nursing is considered to be one of the most honest professions. How would your decision affect the reputation of the nursing profession? Would it tarnish the profession? If your decision would do any of these, chances are it's not the right decision to make. And finally, what if everyone did it? I ask you, what if everyone decided that it was okay to administer medication to hasten a person's death? Would that be okay? Would it be okay if someone made that decision with your loved ones? In summary, by asking yourself the above questions and referring to the ANA Code of Ethics, you can make sound ethical decisions. If you are still confused, please be aware that you can always collaborate with your colleagues or supervisors to consider the dilemma from every perspective. You have the power from going from unsure to exuding confidence. In conclusion, it is of the utmost importance to always refer to the ANA Code of Ethics when faced with ethical dilemmas. Please pick up copies of the above-mentioned provisions of the ANA Code. I also have a copy of the ANA book for your use while performing your duties as managers. If you have any questions, please don't hesitate to ask me. I want to thank you for your time. Have a good holiday.